Well, in the U.S. alone, doctors say that there are more than 2 million people who suffer from congenital heart disease. That's a condition that people are born with.
And as part of Congenital Heart Defect Awareness Week, local doctors say it's important to know that the condition is something that can be treated even if it's diagnosed later on in life.
A year and a half ago that, I don't know if you're going to make it, Mrs. Eggleston.
A prognosis. Now 66-year-old Willow Eggleston from Lansing is happy to say she proved wrong. Eggleston was born with a hole in her heart, but didn't learn about it until she was 45, despite having symptoms her whole life.
Don't be scared to go to the doctor. If you've got a good heart doctor, go. Explain your symptoms. Let them know.
A hole in the heart, one of more than 360 different sub-diagnoses of these defects, according to Dr. Marcus Ha, the chief of cardiac surgery at the Congenital Heart Center at Helen DeVos Children's Hospital.
Usually causes flow disturbances within the heart, which then causes breathlessness and tiredness.
As Eggleston's surgeon and the chief of cardiology also at the Congenital Heart Center at Helen DeVos, Dr. Joseph Vetucato explains defects happen before a baby is born and can present soon after.
If a child is born with difficulty in feeding, it looks slightly bluer than normal, or taking more time to feed or breathe, or they are breathless, they should be evaluated urgently.
Or even later on in life.
What's important is to look at early symptoms, like if you have fainting, if you have exercise-induced chest pain, if there is difficulty in climbing stairs, or if you are breathless on doing sporting activities, or if there is family history of cardiac problems.
Eggleston came to see Dr. Vetucato more than a year ago.
She was extremely unwell, and we got a special device made for her and then brought it here with the approval from FDA.
The customized stent repairing Eggleston's heart, giving her the chance to do things like walking, cooking, and even going to the store with ease.
He actually gave me 20 to 30 more years of quality life. And for me now as a senior to live and enjoy my grandbabies.
Results like that, both doctors say, is proof the condition can be treated in so many different ways at any point in life.
Electrical treatment or drugs or surgery or cardiac catheterization. And it's transformational for patients who can't go down to Maya, who can't walk on the beach. Suddenly they're able to do all the normal things they could do 10 years earlier.
And Dr. Ha there says that most congenital heart issues are now found before a baby is born. And at Spectrum Health, they can start a streamlined care process right away, from surgery to monitoring that person into adulthood. They've also partnered with MSU Research to track these diagnoses. And since the program started in West Michigan in 2012, the mortality rate for children with this disease has dropped 43% in our area.